Hello everybody. This is a live chat on PCOS, and so if anybody is watching or listening, and if you have any questions, please inbox it to us and I will answer them right away. So we reckon that PCOS is a very, very important topic, and so we chose to do a live chat on PCOS. So what is PCOS? PCOS is polycystic ovarian syndrome, and that is the commonest endocrine or hormonal disorder which affects adolescents and young women and women of reproductive age. So how common is it? PCOS affects 1 in 7 to 1 in 10 women, so it is pretty common. So then I'll discuss the features of PCOS. So first of all, polycystic ovarian syndrome is mainly associated with irregular periods. So women tend to have infrequent periods most often. Normally, women have periods between 28 days and 32 days. But in polycystic ovaries, periods tend to be delayed and occur maybe longer than 35 days, sometimes even 45 days, sometimes once in a few months, and sometimes bleeding can be completely erratic and unpredictable. A few women tend to have shorter cycles less than 21 days. So this is the hallmark sign. The next important feature is due to an increase in the amount of testosterone or male hormone in the woman's blood. So normally women do not produce as much testosterone as women who have polycystic ovarian syndrome. So this increased level of testosterone produces various changes, mainly in terms of increase in hair growth on the face, usually upper lip, beard area, sideburns, chest, arms, legs. And this is often associated with very oily skin, an increase in acne, and scalp hair loss. This is the second feature. The third feature is what we determine on scan. And women with polycystic ovarian syndrome tend to have ovaries which have multiple small cysts. These cysts are always less than 9 millimeters, usually measure between 2 and 9 millimeters. On day 2 of a transvaginal scan, we usually see about 11 or 12 follicles in both ovaries put together. But in women with polycystic ovarian syndrome, we see sometimes about 20 follicles in one or both ovaries. That is, each ovary will have 20 plus follicles, and that makes it polycystic. The important thing to understand is some women worry if they are tumors. They are not tumors. Each cyst is a follicle, and a follicle is a fluid-filled sac which contains the egg. So basically there are lots of follicles and all of them contain eggs. Besides this, women with polycystic ovaries often tend to be overweight or obese. This is a very important feature, but there are a minority of polycystic ovarian women who are lean as well. Now, it's interesting that polycystic ovaries polycystic ovarian syndrome occurs in various parts of the world, in different ethnicities. And in each ethnic race, the presentation tends to be a little different. We, as South Asians, and also in the natives of Australia, we tend to present with being overweight and having central obesity. So basically women are of two shapes. They're pear-shaped, they have a slender waist, or they're apple-shaped, they have a broad waist. So women with polycystic ovaries in our part of the country tend to be apple-shaped, and they also tend to have metabolic problems. So they tend to present with diabetes. I will discuss more about this later. And women in North America and Canada tend to have an increased BMI. Women in the Mediterranean tend to have increased facial hair growth. We call this hirsutism. And women in Africa tend to usually have metabolic syndrome like us, and they also tend to be overweight. So this is the different presentations depending upon where you hail from. Now, apart from this, women with polycystic ovaries, as I said, can have altered blood sugar levels, an altered lipid profile, and of course, high levels of the hormone testosterone, which we've already discussed about. Now, I've got a few questions which have come here. So the first question is, I have PCOS. Will I have a problem conceiving? I have been trying for 6 months. So I'll just answer this question first before I go on to looking at the questions I have. The first thing is polycystic ovaries, polycystic ovarian syndrome, is associated often, as I said, with irregular periods. Regular periods mean that a woman is ovulating every month, or producing an egg every month. And if she isn't having regular periods, it's unlikely that she produces an egg every month. And that would mean a delay in conception. So, if you've been trying for 6 months, and if you have irregular periods, then you need to see a specialist to see what can be done. The next thing is, the next common question which women often ask me is, why do I have PCOS? Why do women get PCOS? We still don't know why this happens. It is still a scientific enigma. So we believe that since it occurs in families, you see sisters or first cousins having PCOS in the same family, we believe that there is a genetic basis, and there have been a few genes which have been incriminated. Apart from this, someone with underlying PCOS may not express it until they put on weight. So it's not very uncommon to see women come to you and say, you know, I've been having regular periods while I was in college, and now I'm married, and it's been 2 years, and my periods have gone haywire. And often you will find that they have actually gained a considerable amount of weight in the last 2 years, which has expressed or made them express the underlying genetic tendency to have polycystic ovaries. So there are a few more questions which have come in. Another question says, ma'am, is food habit, can it cause PCOS? So that's what I said. I just said that definitely an increase in weight can produce or unmask an underlying tendency to have PCOS. So it's very important, and I'm going to talk about food in a while. Are there any health problems with PCOD is another question. So first of all, diabetes is more common, and it is at least 4 times more common in South Asians, that is our population, 3 times more common when you have polycystic ovaries than the general population when you're American, and twice as common as the general population without PCOS when you are European. So it varies according to race. Another important risk is that of cardiovascular disease, and this is usually more if a lady is overweight, also has diabetes, hypertension, and an altered lipid profile. And the last risk, a long-term health risk, is the risk of endometrial cancer. So endometrial cancer, endometrium is the uterus. Endometrium is the uterine lining, and if a woman does not have regular periods and does not shed her endometrium every month, then this lining can become very thick and over a period of time can become abnormal, and cancer can occur in this. So we see women who are not bothered about having regular periods present with endometrial cancer at a very young age. So this is important. You need to understand that periods need to occur at least once every 40 days. And if you haven't had a period, and if you know your PCOS, then it is important to take medication to induce bleeding. Otherwise, this endometrium can become thicker and can become abnormal and can lead to cancer at a younger age. So that's something for you to remember. I've got another question which says, for BMI of 29 with polycystic ovaries and irregular periods, married for 1 year, and we have not conceived yet. So I gather that this person, this lady has a BMI of 29 with polycystic ovaries and irregular periods and is married for 1 year. So what would we do if somebody came to us? The first important thing is weight loss. And that is the first line of treatment. lifestyle intervention is what we call it. And normally, it's easy to say we advise 30 minutes of daily cardiovascular exercise with at least 2 days a week of strength training on non-alternative days. We also advise, or if somebody likes to walk 10,000 steps a day is a lot, but it helps weight loss. We also advise calorie restriction in their food and restriction to 1,200 to 1,500 calories. Now, it's easy for me to say all this, but what we normally do in the clinic is we take a detailed history of what the patient is eating and consuming every meal, and then make a meal plan for her. And my first advice would be to eat slowly, because you see women who are very slim usually take longer to eat, and women who are a little on the bulkier side eat quite quickly. So it's important to eat slowly. And the second thing is to cut carbohydrates for dinner and to finish dinner as early as possible by 7 or 7:30. And to halve your portions and to measure the portions as much as possible in the previous 2 meals, and not to eat processed food at all, and only to eat fruit if they're hungry in between. Women have lost a lot of weight adopting this as a means of diet calorie restriction. And we've had patients lose 15 kilos and even get pregnant spontaneously, women with PCOS. So the next question is, what do we do if women have come to us with PCOS? Do they need IVF is another question. So women believe that if they have PCOS, they will need IVF. It's not at all true. So women with PCOS, when they come, we confirm the diagnosis, and if there is no other problem, and if the man is absolutely normal, his semen analysis is normal, then we start very, very simple treatment. Lifestyle intervention definitely is the first important measure, especially if one is overweight. And the next thing is inducing ovulation. So we may start women who are overweight on a tablet called metformin. Metformin is a drug used for diabetics, but it is also very useful in women with polycystic ovaries, because in polycystic ovarian syndrome, there is always an increase in insulin levels. You know that insulin is an important hormone which controls blood sugar. I think everybody knows that. So when insulin does not work properly, it's called insulin resistance. And women with polycystic ovarian syndrome manifest insulin resistance as well as an increased level of insulin, because the pancreas is trying to work hard to produce more insulin in an effort to correct this insulin resistance. So this rise in insulin level is actually the primary cause for the high androgen or male hormone levels. So we correct the high insulin levels and insulin resistance by giving a drug called metformin. And usually we wait. If a woman needs treatment immediately, then we start her on ovulation induction drugs like letrozole and clomiphene. And all we do is to induce ovulation and tell the couple when to have intercourse. So that's very basic treatment. So we carry on doing this for at least 6 months. And if the couple haven't conceived yet, then we move on to the next step, which is IUI, or intrauterine insemination. So that's usually done for about 4 cycles. And if that doesn't work, then the woman may consider IVF. And it is advisable once you start treatment to follow treatment continuously back to back, because there's something called a cumulative pregnancy rate. So it increases when you do continuous treatment. In between treatment modalities, for example, in between ovulation induction and timed intercourse, or after IUI, you can of course take a break. So some people ask, I've had IVF once, and would I need it for the next baby? It's hard to say, it's hard to answer that question, but you may need IVF. Sometimes even simple measures may help. So it is a very subjective thing, and every patient has to be assessed independently and individually, and the decision has to be made. So there is a surgical procedure called ovarian drilling. Now, ovarian drilling means making little holes in the ovaries by diathermy or electric current. So actually burning a little bit of the ovarian tissue in fixed number of places. This helps to destroy some of the male hormone producing tissue in the ovaries and makes the ovaries function normally, so the woman tends to have regular periods for some time. So it works transiently. This is not a first line measure. It is done as a second line measure if medical treatment has failed to produce an egg. So there are some women who, despite us trying to produce eggs, help them ovulate, they don't ovulate. And they are known as resistant, having resistant ovaries, and they may need ovarian drawing. So, and if somebody is not planning on a pregnancy and has PCOS, then it's important also for them to have regular periods. So for them, the treatment we advise is just simple contraceptive tablets. So that will help them have regular periods. And we may also start them off on metformin if they have other symptoms of increased insulin or insulin resistance. So that's a short discussion about polycystic ovarian syndrome. I'd like to end this on a positive note. The first thing is it's important for women not to be afraid and not to feel terrible about having polycystic ovarian syndrome, as is often the case. They have plenty of eggs, and all they need is a little help with ovulation. Evidence has shown that women with polycystic ovarian syndrome also get pregnant in equal numbers to women who have normal ovaries. They may take a little time. The good thing about having PCOS is you are still in control of your disease. So if you can control your weight, you can control all the complications which are associated with, or the risks which are associated with PCOS. And by losing weight, you can actually make your ovaries work and you can menstruate regularly and ovulate regularly. So you are in control. And when somebody has IVF, usually we tend to get lots of eggs. And when we get many eggs and when we can make many embryos, we usually freeze them all. And there are women who come back for their second pregnancy to have their frozen embryos transferred. So this is also an advantage. So with that, I'd like to thank you all. I think I have a few more questions. Somebody has written, I have irregular periods. Is it cause of PCOS? So probably wants to know that person has irregular periods. Could PCOS be a cause? Yes, PCOS could well be a cause, and you need to check with your specialist to see if you have polycystic ovaries. All you need is a scan and certain blood tests and a detailed history taking. And it's important for you to know that. There is one more question which says, my niece is 23, unmarried, and has PCOS. Should she be freezing her eggs? No. She's 23, she has PCOS, and she's not married. No, she doesn't need to be freezing her eggs. I'm sure she'll have plenty. The important thing is to make sure she menstruates regularly. If she doesn't, take medication to induce periods so that she doesn't have any complications, and lifestyle intervention, maintenance of her weight. That's all is necessary. So with that, I'd like to thank you all for the interactive session, and thank you for your listening.